immunologic diseases, and there are hundreds of immunologic diseases. We're going to talk a little bit about autoimmune diseases or immunologic diseases. These result when the immune system is overactive and mistakenly attacks healthy cells, tissues, or organs. Normally, your immune system creates proteins called antibodies that work to protect you against harmful substances such as virus, cancer cells, and toxins. But with autoimmune disorders, your immune system can't tell the difference between invaders and healthy cells. So, doctors have identified more than 100 different autoimmune diseases, which together affect over 24 million people in the United States. It's not clear exactly what causes or triggers them. However, treatment usually focuses on reducing immune system activity. Type 1 diabetes is an autoimmune disorder. This is a lifelong condition where the antibodies attack and destroy insulin-producing cells in the pancreas. This causes the pancreas to make little or no insulin. The blood sugar levels raise to levels which must be controlled by injected insulin. So a lot of people don't think about type 1 diabetes being an autoimmune disease, but it's the most prevalent one. So the body's actually attacking and destroying the cells in the pancreas. So I thought that was kind of interesting.
The actual move that you see now with doctors trying to promote again, babies being on breast milk for a longer duration than what they used to. Because it used to be that the mom would have a baby, they'd give them a shot dry milk. I've seen that. And so actually with the type 1 diabetes, especially childhood diabetes, that's one of the main reasons actually for childhood diabetes. One of the biggest reasons is formula babies. Because the baby the milk, the formula was formulated from cow's milk. The problem is the cow's milk, the molecules, certain ones in cow's milk, is almost identical to what's in the pancreas. And so what happens is the baby starts developing an allergy to the cow's milk. And so then it not only goes after that, it actually wipes out the cells within the pancreas. And that's where you see the childhood, such big numbers in childhood diabetes, was actually from them being formula babies.
Wow, I didn't know that.
It was one of the studies that I came across in some books. My grandma had some books, and it was actually studies that had been done, and that was where in the last 15 plus years you've seen more of a push back to breastfeeding and stuff, and that's actually the reason is the babies being immediately put on formula makes an increased risk for your autoimmune and your diabetes and things like that.
So, some of the more common autoimmune diseases include rheumatoid arthritis, and that one's very common, causes chronic inflammation, usually in the hands and feet. RA affects the joint linings, causing painful swelling and may lead to bone erosion with joint deformity. Yay. Yeah, I've got that too. My knees are torn up from it. Fatigue, fever, and loss of appetite is common. I've not noticed that one.
No, I have no loss of appetite.
Has not affected me.
Well, maybe that's an initial symptom.
Oh, yeah, it must be too far gone for me. Meds, physical therapy, and surgery aim to control symptoms and prevent joint damage. Multiple sclerosis is another one. Your immune system attacks nerve cells in MS, causes symptoms that may include pain. People with MS can become blind. They definitely become weak. They develop poor coordination and muscle spasms. This is treated with immune suppressive drugs. Lupus, we see several people I know that have had lupus. This is chronic and occurs when the immune system attacks healthy tissues and organs. Symptoms can come on quickly or slowly and then get worse. And with lupus, the symptoms will flare, which means they worsen, and then they wane back. Patients commonly with lupus develop a rash over their cheeks and their nose. Lupus can damage joints, skin, kidneys, heart, lungs, and brain. So the treatment includes medication that lowers immune system responses. Another one that I thought was kind of surprising is psoriasis. You don't think about psoriasis being an autoimmune disease either, but it is. When you have psoriasis, The immune system blood cells called T cells collect in your skin. And then the system stimulates skin cells to reproduce quickly, producing silvery, scaly plaques on your skin. So it affects the skin, mostly with psoriasis.
And there's a number of things that can trigger that too. Like my brother had psoriasis. It was ironic. He could go to drill, not have a shower for 2 weeks, and it would go away. As soon as he would take a shower, he could walk out in 5 minutes and he would be breaking out. The soaps actually, he had to get to where he had less and less chemical. He had to find more natural soaps to actually use because these soaps, the shampoos and stuff, just the people bathe and wash in would trigger the psoriasis outbreak. And my other brother had antibiotics last year and he developed psoriasis after antibiotics. Yep. Antibiotics can trigger autoimmune psoriasis.
Yes. Wow. All right, Graves' disease is another one. In this disease, your immune system produces antibodies that cause your thyroid gland to release too much thyroid hormone into your blood. Symptoms can include bulging eyes, weight loss, nervousness, irritability, rapid heart rate, weakness, and brittle hair. This is usually treated by removal of the thyroid gland or partial thyroidectomy. Medication is used to regulate thyroid levels in the blood after that. And then celiac disease is also another immune system disease. This is an immune reaction created by a reaction to gluten, which is a protein found in wheat, barley, and rye. This creates inflammation that damages the small intestinal lining and prevents absorption of nutrients. Symptoms include diarrhea, bloating, gas, fatigue, and anemia. Treatment is a gluten-free diet, which helps, but the condition cannot be cured. So doctors don't agree on which autoimmune disorder is the most common, and many of them are hard to diagnose, so people may have them without knowing it. The causes are unknown, but scientists have some theories on what triggers them. Certain medications, some drugs may cause changes in your body that confuse your immune system. So certainly antibiotics. Talk to your doctor about the side effects of statins, antibiotics, and blood pressure medications in particular. Genetics. Some autoimmune diseases run in families, so you're at higher risk if your family has a history of them. People who have certain genes may also be more likely to have autoimmune disorders. While genes do play a role, they usually aren't enough to cause an autoimmune disease on their own. Infections, people can develop autoimmune disorders after an infection. Microorganisms like viruses and bacteria can set off changes that make your immune system attack itself. This may be more likely if you are genetically prone. Certain risk factors raise your chances of getting an autoimmune disorder. Some common ones include smoking, exposure to toxins, so people that work around air pollution or hazardous chemicals can develop autoimmune diseases more easily. And 78% of people with autoimmune diseases are female. Also, obesity is a risk factor.
One of your big factors with all of those is a poor gut health. I've noticed that, like, there's been a lot of information that comes out on food and different stuff, and I noticed that certain foods that I actually bought started giving me diarrhea, and when I looked, they had one particular thing in common, and it says bioengineered ingredients on the label. When I quit eating those, I quit having a diarrhea problem.
Sorry, on the autoimmune, I just got diagnosed with CIDP, which is, I have to read it to you because chronic inflammatory demyelinating polyneuropathy.
So
It mimics MS, and you start with tremors, you get hand weakness, thumb weakness, feet weakness, everything, legs start. I looked like I was having a damn grand mal seizure because I got the tremors. Decided, okay, it's time to get something done. This ain't just muscle weakness. They ruled it to where, I don't know if y'all remember when my arm swelled up and I had to go in the hospital. That infection is what's triggered.
It's what's triggered that.
Really?
Wow.
From the pick line.
You know, no,
No,
from
just
whenever,
from the infection in his.
from the
Yeah.
infection that I had in my arm. And
When
they
you
to
had
go
that
in and
infection
drug-
after the pick line.
No, it was before the pick line. That's why I had the pick line.
Oh, okay.
And when they scraped that bone and everything out of there,
Mhm.
and then they removed the bursa sac and all that, and they said that that is what has brought this up.
Wow.
I get B12 injections every 2 weeks of like 120,000 milligrams. Makes me feel like a crackhead. So I sat there for 3 hours going, wow, this is great. Got so much energy.
Not used to this. Wow, that's something.
Well, I thought it was MS at first. I was freaking out.
Well, yeah, it would scare you to death.
And they's like,
But
no, no, this
still,
is
it's
totally
It's an
manageable.
autoimmune disorder. They can manage the symptoms, but
A lot of
that's
your
something.
autoimmune people, or people that have that autoimmune abnormalities that show out, are chronic B12 deficient.
Mhm.
And my levels were next to none, but they said that is what triggered this whole thing.
I'll
Was
be
that
darned, an
infection that I had.
infection.
So when the tire iron starts disappearing off the truck, I know where to go.
The five and just remove it off the truck. Mike's drinking it.
We got a hell of a wreck up on 160 right now in West Point.
So you say it's not in our response area?
Not in our area.
Okay.
It just flashed on my phone.
Wow. Symptoms of autoimmune diseases can differ depending on the type and location of the condition you have. Some symptoms that are common, though, include fatigue, frequent fevers, a general feeling of sickness, joint pain and swelling, skin problems such as rashes or redness, stomach pain and digestive issues, and swollen glands. Diagnoses take time and several tests to confirm. Antibody screens will start to look for antibodies that are attacking your tissues. This is a start to diagnosis, but other blood tests include anti-nuclear testing, ESR, which is eosinophil sederate, complete metabolic profiles, C-reactive protein test to check for proteins in your blood and urinalysis. Ultrasounds and x-rays can also reveal joint issues, and of course MRIs can show damage deep in your body. Treatment, however, there aren't cures for autoimmune diseases, yet there are many kinds of treatment that can help control immune system responses and help manage the symptoms. Medications, steroids, of course, is the most common. Corticosteroids are often the first treatment because they work quickly to lessen the immune system's overactive response. These slow down entire immune systems so they can come with serious side effects. Some other drugs focus only on slowing down part of your immune system and come with fewer side effects. So these can target cells that make certain antibodies or get rid of specific proteins in your immune system. So steroids are often combined with anti-inflammatory drugs. They help control the immune system while still supporting organ function. Anti-TNF medications fight tumor necrosis factor, which is a protein that causes inflammation. These are used to treat some forms of autoimmune arthritis and psoriasis. And of course, NSAIDs help ease the pain, swelling, and the stiffness. Then there are drugs and treatment that help manage symptoms, including painkillers. There are also medications that are given for depression and anxiety. Insulin shots, of course, for you diabetics. Sleep medications. A lot of times people with immune system problems have trouble sleeping. Plasma exchanges, and creams and pills for the rashes. They also can give IV immune globulin, which is a blood product made of antibodies that can help correct your immune system without stopping its normal function. If the disorder affects the blood, they may also do transfusions. Doctors often suggest shifts in personal habits as part of treatment. Exercise or physical therapy are common for autoimmune diseases that affect your muscles, such as multiple sclerosis. For those with autoimmune diseases that affect blood vessels, quitting smoking can also help. There are many types of autoimmune diseases. Scientists are not sure why this happens, but most treatments aim to calm your overactive immune system.
So you said smoking, is that tobacco products in general, or is it just smoking?
I would say smoking in general, any type of smoking, because anytime you get the contaminants in your lungs, that can trigger.
It's triggering an
So-
inflammatory response.
So not like
Not,
the dippers.
yeah, not smokeless tobacco.
I'm not aiming anything.
I would
for
say
you.
I
probably
think
not
that-
smokeless
mm.
tobacco. I think
Okay.
they're talking about smoking your lungs triggering an inflammatory response.
Okay.
Because there's certain types of foods and stuff that also trigger your inflammatory responses for your digestive tract or any kind of your autoimmune diseases. And foods, anybody that has that issue should definitely research anti-inflammatory foods, what the difference between inflammatory and anti-inflammatory, and they should certainly do the foods and stuff, because your anti-inflammatory foods actually help to reduce your signs and symptoms.
Absolutely.
I know it helped me a lot whenever I had a lot of issues.
There is a very serious autoimmune disease called giant cell myocarditis.
Yeah.
And so, of course, with myocarditis, you think about the heart. Though rare, this giant cell myocarditis is a life-threatening autoimmune condition that attacks the heart muscle. It has a 1-year death rate of 70%. Holy
Wow.
So once you get diagnosed with that, that's pretty well a death sentence. Like I said, it's very rare, but it does happen. All right.
I hear a lot of, you're talking about T cells, a lot of cancer. Sounds like a lot of it is cancer.
A lot of it does mimic cancer.
That's scary.
And since there's, over 100 of the autoimmune diseases, it's really hard to pin down what you've got.
You remember Steve Brown, maybe not.
I think so.
You know, it took them forever to get a diagnosis on him, and it was one of the autoimmunes.
Yeah, I mean, there's a lot of people that for years never get diagnosed, so. It's pretty
Yeah, I mean, he was, laying in a bed, basically paralyzed from the neck down before they figured out what was going on with him. And ended up, how long? Months, better part of 2 years before he actually recovered, and then didn't completely recover, but
But he recovered
Mostly.
enough, they didn't have the shakes anymore, and he could do them gummy
Yeah.
bears.
yeah.
That was weird.
Yeah. Really strange.
Well, the poor guy, he couldn't write his name in one swoop. It took him like 10 or 15 minutes because his hand shook so bad. And after he got sick, dead still, and he could engrave any gun you wanted done, any design. It was weird.
Yes, that would be weird.
Well, we were talking about the lady that I know, that she's got a target dyskinesia. Yeah, and she just sitting, talking to her, she looks like a crackhead. She's just all over the place. But she can sit and play the guitar.
That's wild.
It's very coordinated and it's sane, but sitting there talking to her, she looks like she's having a stroke, But
Very weird.
That is weird. Yeah. Okay.
Mount Ellis couldn't.
The stutter, yeah.
Sentence
yeah.
because he stuttered, but he never missed a note singing.
Well, it's because
Yeah.
it's the relational
Heard
of
that,
the speed of it, because there's other people that are singers that they can sing just fine, but to actually sit and talk to somebody, they have a stutter.
Yeah,
But it has
that's
to do
what
with
Mount
the
Ellis
pace,
was.
the pace and whatever that they're going at somehow changes it and they're able to do it.
It's strange.